Welcome to American Medicine Today. I'm Kimberly Bonati alongside Ethan Euchre. We have an exciting show lined up for you. Let's get started. So a mental health crisis sparked by social media took center stage recently as the chief executives of 5 tech companies were grilled by lawmakers about the potential harm their products have on teens. Joining us to discuss is Dr. Anthony Anzalone, clinical psychologist at Stony Brook Medicine. Thank you for joining us, Doctor.
Thank you so much for having me on.
Certainly. So why don't you give us some of the biggest takeaways from the Senate Judiciary Committee hearing with Big Tech? And that took place at the end of January. So was really the presence of so many parents crucial to what was spoken about?
I think it definitely made an impact. I mean, this is a problem that has been going on for quite some time, that these companies have been knowing how to really hack our most basic drives and how to keep kids constantly latched onto their products. So to have that personalized touch, to have families be able to express how they feel and let these companies know that personalized impact that they've had on their lives is definitely a step forward, or at least to get both sides of the aisle. When do we say that? Joining together to say that this is a problem, this is a crisis that we need to address ASAP. If there was a way that we could have tech companies allow us access to their statistics, their data, their research, so we can help people, we can help our generation, future generations, our children's generations kind of unhook from a lot of the addictive qualities of social media. I think that would be great. I think that if tech companies could provide some sort of support for creating better educational programs so we can teach parents and children the dangers of excessive and problematic internet use and social media use, then maybe I'd have some hope that tech companies would find it in their hearts to do the right thing.
And we also know Senator Marsha Blackburn even said to those executives, children are not your priority. They're just your product. And she pointed out that internal meta documents valued teen users at just $270, which he called astounding. Is that something you agree with?
Absolutely. I think the fact that we could use the word preying on children, that if I were to follow your children around all day, taking notes on what they're doing and giving them an addictive kind of substance, you'd probably have an issue with that. But yet a lot of these tech companies can do that without any recourse. So to be able to get them away from a lot of this addictive properties, right? Because addiction doesn't have to be a substance; it can be an experience. Right. And the fact that they know what they can get away with, and they can put a price on a child's well-being, it's just something that has to be addressed. And we need to find better ways to help educate, make children aware of how these impact their daily lives. What I didn't hear spoke more, the fact that they didn't say, hey, we're going to allow people to work with us. We're going to work with the public. We're going to work with governments to come up with universal plans to be able to identify kids at risk. That's what was missing. So the fact that companies want to kind of keep their secret sauce and we're not allowing a lot of the researchers in there that could help promote, kind of undo a lot of these changes, these neurological changes that are happening in kids' brains as we speak. That's the bigger question. So I don't know where the money came from, but I'd love to know where the statistics and the data are and what we can do to have access so we can help youth.
As a parent of a 14-year-old, how much screen time is too much?
Any.
Yeah, I've been asked that question. What age should your kid go on social media? My response is somewhere in their 40s, but I don't think that's practical. But that there's what the guidelines are, and I guess there's reality. I think that the bigger question is how much we can teach children to be more digitally literate and how much we could teach them to be digitally healthy. It's not really so much how much time is spent on the devices, but how it's used. This is something that's just mindless, where our impulse is just, we're bored and we want to go to our devices to be able to deal with the boredom, or we're using it for a reason. I like to say that devices are good servants and bad masters. So when you have children that can connect, let's say that you're an LGBTQ youth and you need to connect with somebody and you're in a rural area, it's imperative, it's a lifesaver. But if you're just a 14-year-old and you're constantly flipping on Instagram or TikTok, that's where it becomes problematic. So we'd like to, there's what the recommendations are of no more than 2 hours a day. But I think in the end, I'd love to see that question asked in a couple of years when we are teaching children how to be more digitally literate, more digitally healthy, and to figure out what the right amount of time is. Because the way that we go into our devices is more important, I think, than how much time we're spending on it.
Yeah, well, they claim all that screen time is highly addictive, almost like taking drugs like heroin. So it's something we need to keep a watchful eye on so that our kids don't fall prey to these social media sites. And we're also seeing a much higher suicide rate in teens that are on social media. And it's crazy that nobody has held them accountable.
Absolutely. When we think of all the different areas in which excessive, even just regular social media use impacts our children, the easier question to ask is how hasn't it impacted them? We know from a behavioral level, we're getting children with less sleep. We're having children with more eye strain. We're having greater levels of family conflict, greater levels of depression, anxiety. A lot of people going online, just engaging in a lot of distortion, saying that the rest of the world is perfect and my life is tough. And as teenagers are developing, we know it's a time where it's awkward and self-esteem is always very fragile. So when you have companies that even come out with apps that can make you look the most beautiful that you can look, it kind of feeds into a lot of those distortions and sees the world in a very skewed manner.
Dr. Anzalone, what are some, I guess, signs that parents should look for? That the kids might be the victim of a cyberbully or, just what are some things that we should be on the lookout for?
I think overall with internet use, you're looking for the classic telltale signs of even just any kind of addiction, that they're spending longer time on devices, that they're kind of withdrawing from people. To your point about cyberbullying, I think you want to look for just any changes in behavior, any kind of changes in emotions, that they're withdrawing from activities that they formerly really enjoyed. But it's such a complex issue because even with, say, cyberbullying or not, if they're spending so much time online, then they're not engaging in the real world. They're not engaging in activities that would make them feel good. So it's tough because the internet is the wild, wild west. It's the last remnants of the wild, wild west. So there's a lot of anonymous attacks. So you really want to be able to have that relationship with your children, to know what's going on with them. I always tell parents, go look into the family media plan. It's a great start. It's recommended by the American Academy of Pediatrics. It's a great start of being able to have a good conversation with children about all the different facets of internet use, both good and bad.
Well, thank you so much for being on our program, Dr. Anthony Anzalone, to put a spotlight on what's happening with our children and doing what you can to protect them and keep them away from these social media perverts, for lack of a better term. Thank you for being on the program.
Thanks, Doc.
My pleasure. Thank you so much.
Stay tuned. We'll have more after the break. You're watching American Medicine Today.
2 neurosurgeons couldn't figure out anything that was wrong with me or what I would need surgery for. Dr. Bonati, without even seeing me, knew I was hurting, knew they could help me. First time I came in here was Monday, and today is Thursday. I've had 2 surgeries and am doing fantastic. I'm still in shock that I can walk. That's all within 4 days.
Visit AskBonati.com.
I'm Brian Villela. I'm a retired police officer. I did 30 years law enforcement. I love travel. I love cruising. I've made cruising my part-time job after I retired. So I own some travel agencies and I enjoy travel. I've been to European countries, Asia, Russia. Part of my travel entails me on the airplane, trying to sit in an airplane small seat for extended periods of time. That became increasingly more difficult.
Brian's back pain began after a work injury 30 years ago.
I injured my back in '91 on a bad incident at work. I got involved in a situation where this guy was trying to commit suicide. So 3 of us tackled him and a pile of deputies, and this guy ended up on top of me. in this guy's driveway as we're struggling with him. So days later, I was unable to walk, couldn't roll out of bed. So in that case, I was on crutches. It took me about 7 months to get surgery after that injury. It was a lot of evaluations, a lot of MRIs. I was actually out of work almost 9 months.
Since his surgery in 1991, he experienced minor back problems on and off. He resolved these issues with rest and over-the-counter medications, until another incident in October 2020 left him with the realization his pain was going to require surgical intervention.
Well, I was on the boat and we had the dogs with us, and one of the dogs was in the water, and it was a pontoon boat which sits above the water level, probably about 2 feet. And I would reach down below my legs into the water to pick him up. He's about 110 pounds. And when as soon as I did it, I felt my back like pop or painful just surge. And right then I knew, oh, I shouldn't have done that. But the dog was happy. Got him back in the boat, and I sat down for a while, and a day or two later, I had increasingly more and more pain. It just wasn't going away. Pains were radiating down my right side. I started in my thigh, and then it worked into past my knee into my calf. And then eventually, weeks or two later, it was actually my ankle and foot. I found that I didn't have the ability to walk in the store, that I'd have to hang onto the grocery cart. My stamina was just zilch anymore. As far as walking to the car, I'd have to hold on to something. I found relief by using a cane. And a cane wasn't for every step. It was more just for stability, just to hang on to and stop and wait for a second before I could continue.
In late December, Brian met with a surgeon, and they told him he needed a fusion.
The pain management group initially gave me pain medication. They upped it. I called the next day. I said, this is not working. They upped it again. From there, they gave me 2 epidurals procedures, which I had a minimal relief, but the pains came back again. And the next thing I know, I was sitting down in front of a surgeon. He had my MRI on the screen, and he started explaining to me where he was going to put pins and rods on the following Tuesday. I said, time out. This is not for me. I know what it entails. I know that it creates stiffness in that region of the back, and then it long-term effects. It's going to put extra pressure on the rest of the joints, and it's not for me. It's not for me. It's not for my lifestyle. It's not something that I'm willing at my age to submit to. So I said, no, that's not going to happen. I'll continue with the pain meds and seek other treatment.
He continued to search online, where he discovered the Bonati Spine Institute.
Initially, I just did a interview with a patient consultant that requested all my paperwork and the MRI to be sent over for a doctor's review. And then a doctor called me a week or two later. And the doctor spoke to me, and the first thing he said, no, we don't believe in pins and rods. We want to go in as minimally invasive as possible. And they started explaining the surgery and how it would be, and that they've reviewed my MRI, and they were quite confident they'd be able to help me. As soon as he said no pins and needles, I was on board. Came in, sat down with a practitioner, and they measured everything. They discovered then that one leg was smaller than the other, checked all my reflexes, did the blood tests, did the MRI, did the x-rays, all within a 3-hour window. And before I left there, I had a surgery date 1 week later. Come back the following Tuesday. So to me, it just simplified the process, having everything there at the same campus. The MRI was up on the wall, and you could see that the bulges, 4 in a row that were all, and the 2 at the bottom were greatly impacting the spinal cord. And it's no wonder I was in pain. And he says, I can make you pain free. It's going to take 2, maybe 3 procedures, but we can make this happen. Just go for it. I'm ready to go. By then, I'm looking at 3 months of pain already. I'm ready to get it resolved.
Surgery at the Bonati Spine Institute is performed using conscious IV sedation, a technique that allows surgical guests to remain aware and alert enough to speak with the staff during their procedure, all while staying calm and comfortable.
First procedure, they brought me in and reassured me that everything was on target. I could see it on screen video to my right, and I could actually feel them snipping the bone. It's like they were like a nail clipper on the bones. And then they were asking me, they were testing pain thresholds, and they were asking me, did I feel it in my back versus my leg versus my ankle, where I was feeling each pain, where it was radiating to. And based on my analysis and what I was telling them, they were able to identify where the problems were. Right after the second surgery, I remember my posture improved. My body was relaxed instead of stressing or preparing yourself for pain. My walk was more steady, and my total gait was different.
Brian compares his surgery from 1991 to the Bonati Spine Procedures in 2021.
In my case, I can compare it to the other surgery in 91. The recovery time was much quicker. I was on my feet within hours. There was no hospital stay. I went a period of 2 weeks with no pain medication whatsoever. And whereas before the other surgery, I was still on pills daily, trying to wean off of them over a period of time. In this case, it was none. I felt very good. I felt more mobile. And the support from the Bonati team, that they checked on you that night, they checked on you the next morning, you were back in the office immediately. Whereas before, you get a checkup with the doctor 10 days down the road. It just felt a lot more relaxing and less stressful.
Now that Brian's been treated for his lumbar spine issues, he is finally looking forward to more adventurous travel experiences.
Life is resumed. I got a new home. We moved here, and you've got so many projects to do, whether it's hanging the TVs on the wall or getting things together, organized, emptying the boxes, getting organized. And fun with the dogs, and being able to mix and mingle with friends, and not being so many excuses you come up with. I can't go today. You can't plan ahead because you don't know what you're going to feel like next Tuesday. Are you going to be in a good mood, or you're going to be grumpy because you're in a lot of pain? And my friends have noticed, like, wow, you can walk again. Wow, you can tell you're feeling much better. I could tell you were in a lot of pain last time I saw you. So it's really good to be able to refresh with those people and have your life back. Be back in some normalcy. The one thing that stood out with Bonati was having the one-on-one contact with the doctor. It wasn't just, you're going to have a procedure next Tuesday and Dr. So-and-so will be doing it. He was there in front of me, standing in front of my MRI, and was quick to say, hey, this is what we're going to be able to do for you. I think that the support before, during, and after is unheard of. It's just unexpected. And with that support and what we're going through on our end, it really helps. That's every 2 weeks I get a phone call. How's everything going? How you feeling? Do you need anything? And that helps a lot. Don't delay. Go out there, get it done. It's an easy procedure. It sounds scary, but it's all part of the process. And you get it done, and you'll get your life back. You'll be back on your feet.
To see more stories of recovery just like this, search the Bonati Spine Institute on YouTube, Roku, Amazon Fire TV, Google Play Store, and Apple's App Store. Welcome back to American Medicine Today. I'm Kimberly Bonati alongside Dr. Craig Wolff of the Bonati Spine Institute. Why is it so many doctors are telling patients that they need to seek out fusion as their way to get beyond whatever condition they suffer with?
In the late 90s, I was a doctor in Tulsa, Oklahoma. I'm an orthopedic surgeon by training, and so I was in a practice that was a spine surgery practice. And all we did was fusions. And then I would say, oh, we need to decompress the nerve. I would tell the patient that. And I'd go to my partners and they'd say, well, you can't decompress the nerve alone. You have to do a fusion. I said, why? I can decompress the nerve. That's really easy. Because we don't get paid. And the difference between doing a decompression and a fusion to the surgeon was at least $12,000. And that's just one level.
Right.
So there's the answer. Why are we recommending fusion? So when a patient goes to their doctor, the first thing is they can say, you have a bad, let's talk about the neck. You have a bad C5-6 and C6-7 disc. There's a little pressure on your nerve roots, maybe a little pressure on your spinal cord. So we're going to go in the front of your neck and we're going to do a fusion. Throwing in $30,000 worth of hardware. Ooh. They never give you can you go in the back of my neck through a little incision and just decompress the nerve and leave my discs alone?
Right.
And there's two reasons. One, they're not going to make money. And number two, they don't know how to do it. Okay, so I'm in Tulsa, Oklahoma, and an ad comes up in the newspaper. Alfred Bonati, the world, and at this time, this is the 90s, is going to talk about minimally invasive spine center at a big hotel. So a lawyer friend of mine said, this is really interesting. I said, I don't know what minimally invasive surgery is. He said, please come with me. And I said, sure, I have no problem. Dr. Bonati gave a lecture, and then afterwards, I probably asked a question, and he knew I was a doctor. So afterwards, he came to me and he said, come have lunch with me. Right. And I sat down, and he's such a nice guy, and he said, you're hurting people. Stop. you're doing fusions, and
Yeah.
do you believe in them? And I said, no, I can't say I believe in or not believe in. That's just what we do. He goes, but why? And he goes, because we don't know any other way. And he goes, I will show you another way. And I said, you would show me? And he said, if you come to Florida, I will show you. And after talking even longer, he said, if you come to Florida, you're hired. And you know what? 2 weeks later, I moved to Florida, and Dr. Bonati taught me these things. And the number one principle is, in medicine, do no harm.
Correct.
And fusions are, we could almost say, do no fusions.
Right.
Of course, I came to Florida from Oklahoma, so I didn't have a Florida license. It takes it like 3 months to get a license. So Dr. Bonati said, I want you to look up all my patients. You have full access to them. Call them on the phone and find out everything you want.
Yeah.
So I put together 5, 6, 7 different studies of all these patients on how they're doing a year after, 2 years, 5 years after. And the results were phenomenal. So much so that Dr. Bonati and I, anytime there was a conference somewhere where this new field of minimally invasive surgery, they of course want Dr. Bonati to speak. And I would give Dr. Bonati, either he would do it or I would do it, a talk about this is what we've been doing. And he was so far ahead of the guys who said they were doing minimally invasive surgery.
Right.
What they were doing is maybe sticking a needle in your disc.
Right.
Dr. Bonati is the first person to use lasers. We use lasers in the disc. And now when you see the doctors out there saying, we're minimally invasive surgeons, we use lasers, Dr. Bonati would tell you now, yeah, we did that. We
Decades
did the
ago.
research. It doesn't work.
Right.
And it doesn't work.
Yeah. It turns out that it can be one of many tools, but it is not a magic tool, and it's not the only tool to use. Yes.
When you're a patient, you're going to, if you hurt your neck or your low back, you're going to go in and they're going to say one of two things. If you're a young person, they say you probably have a herniated disc or you have some bulging discs. If you're old, they're going to say you have spinal stenosis and pinched nerves. And maybe some bulging discs.
Right.
And you're a mess. That's what they always tell everybody. You're a mess. You have, let's just say, the neck. You have C4-5, C5-6, and C6-7. So that's 3 of the 7 levels in the neck. What are you going to do, doctor? What can we do? Well, what we're going to do is we're going to go in the front. We're going to take out the disc. We're going to put metal fusion cages in your neck, and then you're going to be fine. Does it matter that you fuse half of a person's neck? Will that change things? And they say, probably not. But if it does, we'll deal with that later. Well, absolutely it does. I would never recommend anyone have a fusion that would be 3 levels. But why? What goes on? So any level you fuse, you're stuck. It can't move anymore.
Correct.
So the other levels got to move more. If you have a 6-cylinder car and 2 cylinders drop, the other 4 cylinders, you're going to kill your engine, okay?
Right.
So we don't get the movement. So what happens is the people have the fusion, and within a few years, something else goes bad.
Yes.
And what happens is the level that's still moving, either above the fusion, below the fusion, or both, they go bad. What do you mean go bad? Their discs fall apart because they're having to do way too much work than God intended them to do, or nature.
Yeah.
And they develop the arthritis and the stenosis. So then they come to us. Not only do we then fix the level above and below it, but often at the level of the fusion itself, the disc was removed, but the narrowing of the nerves was never addressed.
Yes.
If there's patients with fusions right now, hope is not lost.
Correct.
If you have fusions in your back, and you have, what you will have are rods and pedicle screws. Few things can happen. Those rods are sitting underneath your muscles. Your muscles move. Your back muscles are rubbing on those rods and screws. And of course, what happens? Go ahead, start rubbing your muscle right now hard.
Yeah.
It's going to become irritated and painful. We can take that out and get rid of that muscle pain. That's one thing. There's another thing that can go bad just with the fusion stuff. When you put the screws in, the screws go right next to the nerve.
Yes,
if
they
you're a
neighbor them.
little bit off, a millimeter one way or the other, you're going to bulge the screw may actually hit the nerve, or over time erode out of the bone into the nerve. And then the answer is not, we should add fusions to the fusion you have. It's, we need to take out what we put in. But that's not being done in the world right now.
Right.
Except what we're doing. At the Bonati Spine Institute.
We'll be taking a quick break. We'll be right back with Dr. Craig Wolff talking about fusion surgery.
I think everybody was shocked, like, really, you had surgery today? I had a drain tube. I was at my desk doing payroll for 200 employees, worked till night, got up, went to bed.
Actually, the recovery was great. I mean, I really immediately felt the difference. I was able to go back to work within a couple of days.
The progress after each procedure was amazingly good. The recovery, all told, has been phenomenal.
This is the honest to God truth. And was recovering, I didn't feel anything. The pain that I was suffering is gone. I can go back to work in like 3 days.
The surgeries that I had, actually, I recovered very easily from, I would say. I actually went to work the following afternoon.
That afternoon, when it was done, I actually felt so much better already.
6 days after surgery, I was back in the gym, slowly but surely working my way back to fighting, back to basically 100% of fighting, you know? So 6 days, and everybody was in awe, like, didn't you just get out of surgery? I'm like, yeah, I feel great. And like, okay, let's see how you do. And I was bowling with everybody, and I'm in the advanced class. So that sounds a lot right there.
First time I came in here was Monday, and today is Thursday. I've had 2 surgeries and am doing fantastic. I'm still in shock that I can walk. That's all within 4 days.
Bonati succeeds where others fail. Welcome back to American Medicine Today. We're continuing our discussion with Dr. Craig Wolff of the Bonati Spine Institute and about why fusions fail.
So you may have pain because the muscles are rubbing on the fusion hardware. The hardware itself may be malpositioned or may have become malpositioned, not the surgeon's fault, but with time and decay of your back. And then the thing I mentioned earlier, the level above and the level below the fusion, for sure, as we speak, are
Chain
going
reaction.
bad and are ready to bring you to another surgery in the future.
Yeah, it's bad news because they mingle and tangle in nerves. Again, they loosen in the bone, and 85% of 3-level fusions fail. And the smidgen that seem like they're going to be successful, those fail in 2 years. So do yourself a favor, listen to Dr. Craig Wolff of the Bonati Spine Institute and avoid it at all costs. Thank you so much for being on the program. If you would like to find out if you're a candidate for the exclusive and patented Bonati Spine Procedures, visit askbonati.com, and you can see more about what the Bonati Spine Institute offers by checking out our app on all your favorite streaming devices. Thank you for watching. If you have any comments or questions, contact us at the numbers below, or you can tweet at Dr. Bonati using the hashtag American Medicine Today or hashtag AMT. We would like to hear from you.